Hi, I'm Dr. Shetlin, and I just want to take a few minutes to talk about common mistakes that chiropractic physicians make in personal injury. Now, what's crazy about this is there's one I didn't add, and I talk about this extensively in another video, but one of them is being an active, donating part of your state association. Please review that video on another time, but it's so important for us to support those supporting the freedoms we enjoy to practice in our state the way we want to practice. So circle back to that. But this is a really important one. Before I deep dive into this, I want to point out that as chiropractic physicians, as soon as we graduate from chiropractic college, us, just like a physical therapist, a massage therapist, an MD, we're all legally licensed to treat in personal injury. But docs, that doesn't mean we're good at it. And I just want you to put on your patient hat for a second and ask yourself, if you had the choice of going to a certified brain surgeon or a brain surgeon that is not certified, just happens to call themselves a brain surgeon, they're a medical doctor, but they're like, hey, we're going to do brain surgery. Maybe they graduated from some little island in the Caribbean or something, versus having that additional training and expertise and testing to become a certified brain surgeon. If you or one of your kids needed a brain tumor removed or a blood clot removed from your brain, which would you choose? Of course you would go with the certified one. Now in personal injury, these are they're medical legal cases. They're complex. And though we are licensed to treat them from graduation, that doesn't mean we're good at it. And the sad thing is we don't know what we don't know, and that leads to the problem of first do no harm. We took an oath to first do no harm. But when we're not getting additional training, when we're not sharpening our skills in a field of medical legal that is constantly changing the goalposts, changing the rules, they're changing things up on us. So we have to be on top of our game, and we have to begin with the end in mind as the doctor, where we do the proper workup, diagnosis, initial report, and pave the way to begin with the end in mind so the attorneys can do their job for the patient, or everybody loses. The doctors don't get paid as well. The patient doesn't get taken care of as well. Medically, because maybe we don't know the research guidelines, how long or how frequent to treat, what treatments work best in the research, in the personal injury for a trauma of that sheer force nature. Maybe we're not co-caring because we don't have the confidence to refer out to other healthcare providers because we think, oh, if we refer them out, we might lose them and they might not come back. So just because the money, now we're treating the insurance and the money rather than treating the patient, we're doing things maybe the way we shouldn't be doing them. And of course, if we don't document right, the attorneys can't wrap it up to get the patient paid properly, to get you paid properly, or to get themselves paid properly. So I'm not saying this to make anybody feel guilty. I just want to put on your radar that we don't know what we don't know. And if we're treating personal injury cases without additional certification training, we are doing a disservice to our community. And I don't say that in any rude way to you personally. It's just a broad swipe of the brush to say, let's pause. If we're going to work in personal injury, let's make sure we black belt our skills or have people that we work with that are black belts that we can co-care with and still do the best we can so we first do no harm. So that's why, well, that is number one. So that's why I recommend that you get certified in personal injury. Certification, there are 3 different certification courses out there that I recommend right now, and the Whiplash group is the shortest and easiest one. So with us, we have an 8-module certification where you're doing videos, watching them, studying them, and then taking a test. So we know that you're learning the material proficiently. And then of course you're a member of the Whiplash group, so now you're networking with other like-minded doctors and attorneys that are constantly sharpening our skills and helping each other stay top of our game in this area. And then we can reach out and go, hey doc, this happened, I got a question, how would you look at this? Or what do you think of that? So we've got people that we can talk to that are also very skilled in this field. Okay, Jeff States has a 60-hour training course, which is phenomenal. And I want to tell you, value-wise, I signed up and took his course back in 2002. And when I took that and applied that information, because he takes the Croft research and this medical research in personal injury, and personal injury is a physical trauma requiring the physical medicines to help rehab it. We can't just cover up the symptoms with sleeping pills and muscle relaxers and expect the person to heal up properly and not have long-term adverse effects. We have to engage those injured tissues with chiropractic, physical therapy, and massage at the right times, the right frequencies, for the right length of time, monitoring with re-exams each month or each 12 visits, whichever comes first, and updating our records so that we, again, begin with the end in mind, and we're checking the boxes along the way to help make sure this patient is treated properly and the care is delivered properly and it's documented properly. That's how we make the magic happen. Okay? So when we do this, it's a game changer. When I took Jeff's certification course back in 2002, I doubled my case averages by implementing what he taught about taking the research and how do you put it into practice to make more money legally and ethically, to document better, to help the case and the care, and to treat better and properly. So the insurance companies and opposing attorneys can't say, oh, you overtreated or you overcharged, which is the two most common things that we hear in personal injury as a physician, or from an attorney that's not a good attorney, that's just trying to take shortcuts and doesn't value what you do. So very important to get certified. His certification course, amazing. And I look back over the course of my career going, wow, I took that early in starting my career, doubled my case averages. And I look at over the course of, and I had a nice family wellness and corrective care practice, and half that, half personal injury. Well, just with my personal injury cases, I don't know, 5 a month or so, I ended up making an extra $1.6 million over the course of my career that I wouldn't have made had I not been certified, where I paid that $3,000 back then to get certified. So why somebody wouldn't invest in themselves, since you're your number one most valuable asset, invest in yourself and you're guaranteed to get better returns than investing in the stock market. You should be able to grow your practice 15 to 30% per year, implementing the right stuff and continually sharpening your skills and sharpening the saw, as we learn in some self-help books like 7 Habits of Highly Effective People. This is how we master the game, master practice and serving our community. Of course, now there's a new certification program out there. It's 150 hours, and it's sponsored by the ICA, and it's the AMTI program. Getting a certification in any of these 3 or all of these 3, fantastic for you. You'll get nothing but ROI, huge ROI, for what you do investing in yourself. So why wouldn't you want to start with that first step? So that's the first thing I would suggest. So again, there's myself, there's also Michael Coates with Personal Injury Made Easy, amazing training there. An attorney that does what we do in the Whiplash group, he does from the attorney's perspective. It's amazing how we're just 2 peas in a pod, Michael and I, on how we think on personal injury. The other one's failure to understand the CROF guidelines. Of course, if you're getting certified, you're going to know the CROF guidelines very well. Knowing the CROF guidelines and implementing them in your state, or encouraging your state association to accept them as your state or country accepted guidelines for chiropractic care or physical rehabilitative care post motor vehicle collision. If they're accepted by your state or your country, it's easier for you to leverage them, or the attorneys to leverage them and use them to make sure you get paid fair exchange for your services after you've treated somebody, because you followed state guidelines or country guidelines. So take the action steps of being involved in your state association to help them understand the CROF guidelines. And Jeff States, Dr. States and myself and Michael Coates, we're happy to help you carry that ball into the end zone with your associations, because it benefits everybody. You, me, the patient, the attorneys, makes everybody's life easier when we have those accepted as the state guidelines. Some people are like poo-poo on the CROF guidelines. Why? Because they don't understand them. You don't understand the power and leverage that these have created for your practice and your profession and your patients. So in my book, Whiplash and Hidden Soft Tissue Injuries, I try to address the physics of a car crash and how those physics transfer from vehicle to us, the occupants inside. We as the occupants experience a whole different set of physical forces than the vehicle itself. For example, if the passenger, the driver, is the only passenger or only occupant in the vehicle, when the car is hit from behind, if they're rear-ended, their seat loads, so their head is still holding still while the seat loads back, then the head starts to go back, and then the seat actually launches forward faster than the car is actually moving. So the torso and the head are moving faster than the car itself. So the human occupants experience a different set of physics than the car itself. So when we have accident reconstructionists come in to court and do all these fancy schmancy things about, oh, the car was moving this fast and the skid marks and the weight of the car, and it's like sitting down in a chair, or it was like riding a roller coaster. That's all junk science. It's not comparing apples to apples. So we need to understand the physics of, like, what is the physics that apply to the vehicle? What are the physics that apply to the occupant? How do human tissues respond to these kind of physics? Especially if they're sitting straight or the head's turned slightly. Mom's reaching for a kid because she heard the screeching tires. She wants to make sure the kiddo's braced. Now they're in a malposition. There are so many factors in a motor vehicle collision, complicating factors, as the Croft Guidelines calls them, that we need to be aware of and understand. Ethics, the Whiplash group were huge on ethics. Folks, if we're treating the insurance, we're saying, oh, in Utah, for example, we have $3,000 PIP. Some states have MedPay, which MedPay is voluntary version of PIP. PIP is you have to have it. It's just required. It's when you get your state minimums of insurance. MedPay, it's voluntary. And a bad insurance agent is going to try to make the monthly payment the cheapest they can and maybe shortchange somebody on the proper. The last thing we want to do is be underinsured when something goes wrong. So make sure you get a good agent and you educate your patients to get good agents to make sure they have the proper coverage in the time of a crash. But we don't treat the insurance, we treat the patient. And that's why we want to work with good, trusted attorneys that we know, like, and trust, that are getting certified, that know the value of chiropractic, PT, massage, and medical care when it's regenerative medicines or a pain clinic, or surgeons when it's necessary to have surgery. But they're doing the latter properly, because the research shows we're supposed to start with chiropractic and massage, then graduate to physical therapy. If those aren't working, then we graduate up to injections or additional pain meds while they're getting more therapy, adjustment under anesthesia, surgery. We don't just go, oh, you were in a car crash, go straight to surgery and PT. That's usually not how it goes. There are cases that's necessary, but that's usually not the way it goes. And I speak from experience. I was rear-ended by an ambulance, 14,000 pounds, while I was in a rear-engine car, a DeLorean from 1981, 82. So it was engine block, 14,000 pounds, engine block, 2,300 pounds, my neck, boom, broke my neck on impact where I was paralyzed on impact, car kept running, had a second impact head-on into oncoming traffic. So in the Croft Guidelines, I would be a grade 5 injury. Most of us are going to see grade 2, 3, 4. Most of us chiropractic physicians and PTs are going to see those in our office, the majority. But a 5 gets surgery and then comes back to chiropractic, physical therapy, massage, and the thing. So know your grading system and know how that grading system equates into the care program so the lawyers can leverage that against the insurance for your care. If we're just saying, oh, your PIP is exhausted, your insurance says you're done, so we're going to cut you loose at $2,500 or $3,000. That's unethical. We're treating the insurance, not the patient. Oh, the patient was at fault, so they only have care to this point. Maybe you work something out in your office where you treat at-fault patients with your attorneys and stuff, and those that cause the accident. Maybe you have some sort of scholarship program that after their bills are done, you make an affordable thing that they pay for, and they can still finish some sort of program close to a 2 or a 3, grade 2 or 3, so that they at least get the proper care that they needed. So we're treating the patients. And understand, when we do things like this, the universe, reward's not the right word, but that law of reciprocity, it just flourishes in these kind of situations. Like, I'm going to take care of this patient because it's the right thing to do. Chances are they're going to refer in other auto accident patients that are over here that have the insurance to cover it. And it just, over the course of the years, it just all balances out so nicely. So treat the patient, not the insurance. Treating insurance is unethical, docs. We got to do, first, do no harm. We got to do the right thing. Don't just treat till their PIP's exhausted or their MedPay and then cut them loose. Work with good attorneys that can take it to the end zone. Failure to document clearly is a really important one for us to recognize, because we are trained, and I can speak for the chiropractors, we had such amazing diagnostic training at our schools. I went to Palmer College. I know Palmer and Parker, and all of them should be amazing at this because we have to have it to pass boards. We are incredible diagnostic clinicians when we graduate from school. Medical doctors, I'm sure you guys got it too. PTs, now there's doctors of PTs. You guys have really bumped it up another level, and kudos to your profession for doing that. We need to do the proper workup, diagnosis, and then document that in an initial report. If you're not doing initial reports, I will argue till we're blue in the face that you need to do initial reports. Some people say you don't need to. Some attorneys say, oh, I don't need that. Look, if we can do most of the work up front and pave the way for the case by having a good workup, diagnosis, and initial report that explains what's coming, explains what 30 or 40 diagnostic codes that are working diagnostic codes. You can change them through the course of your re-exams, cut some off, put some new ones on there as you're noticing some things that are like concussion that maybe you didn't notice before, or a shoulder problem that's flaring up now from the seatbelt that it wasn't on their radar in the beginning because they were so focused on the headaches or the back pain. You want to have working diagnoses and alter those through the course of the care. But an initial report is so powerful. When we send a rocket to outer space, it uses 90% of its fuel just breaking the atmosphere, and then just 10% cruising around up there. It's the same with the initial report. You're spending a lot more work on that day 1, day 2, and we teach you and coach you and instruct you how to legally and ethically get paid fairly for doing a detailed exam, x-rays, measurements, and a report. And now you've just clearly documented that to pave the way for the care in the case. And what it does, if it's done right, it sets up so when it is submitted to the insurance is going, oh my gosh, I need to set aside this much for this case because they have an attorney, so they're serious about it, and the doctor's really documented a lot of potential injury. But when we have 1 or 2 working diagnoses, which I see all the time from the emergency room, oh, they have cervicalgia and the V code for being in a car crash, that doesn't help the case much. We need to pick it up. We certified specialist physicians and doctors need to pick up the slack and clean that up with a good workup, diagnosis, and report. So documentation is hugely important and way, way, way underperformed by so many docs. So, and it's easy. That's what we want to do, is teach you how to do it easy. So it's just smooth. It's not as much work as you think it's going to be, because we use templates and your great skills and our training, so it goes smooth. Number 5, failure to do monthly update interim exams and reports. These are so easy, and I'm telling you, we are black belts at this. Jeff States and I have really helped you streamline these docs where you can do an exam in just a little more time than it takes to just do an adjustment and treatment. You don't adjust on exam days. We'll go into that on another day. For a medical doctor or PT, maybe in your field you can, but chiropractic code is a mixed code of exam and treatment. So if you have exam, treatment, it confuses the system. So you don't want to adjust on exam days. You can do the therapies, but not adjust. There, we went over it anyway. But we want to do these every 12 visits or once a month, whichever comes first. We don't want to be dragging these things out where we're not documenting their progress or their lack of progress. And if there's a lack of progress, we want to make sure that after 4, maximum of 6 weeks, we're referring them out for co-care, referring them to a pain clinic, referring them to the PT, or from the PT to the chiropractor, so that we're crossing over to another medical doctor if you question that they might need surgery, refer them to the surgeon for the consult. Maybe they don't need surgery. You're not the expert in that, chiropractors. The surgeons are. The surgeons are not the expert in chiropractic. So when they're saying, oh, don't go to a chiropractor, you're crossing the line there, doc. Docs, when you think surgery is necessary and you're not referring out because you're just trying to milk the insurance and adjust them as long as you can with adjustments or PT, crossing the line there. Co-care. We want to co-care these patients. It's just beautiful when we all work together on this stuff. It just works so much better for the patients, and the attorneys appreciate it so much when there's more than just one license on a case. But back to number 5, we got to do those updated exams and reports so that we can see that progress. Every visit they come in, you don't be doing a 0 to 10 scale, the VAS scale. It's confusing because it's up one day, down another. But every 12 visits or every month, now you can see progress. The insurance can see progress because they see paperwork. They don't see the patients. So this helps make it more clear for the attorneys and for the insurance to see what's going on. But if they plateau for 4 to 6 weeks, we have to refer out for co-care, or we have to release them. And remember, we don't use MMI anymore. We use static MMI, which means they're done with the progress that we can make in this office. We can still do some palliative care, but the progressive care has plateaued here. But that doesn't mean they don't need care in other offices. So that's why we don't want to just cut off all their future care by saying something like, oh, they're at maximum medical improvement, when they aren't. So be very careful with those terms. Number 6, this really applies just to chiropractors, still using travel cards. This was really common in the 80s and 90s. a fast little card to keep track of the patient and when they came in, and chicken scratch notes that mean something to you but means nothing to anybody else of what you did that day. And I just used to crack up at doctors in my town that they would turn in their travel cards to the insurance isn't willing to pay them. They get so mad. Well, here's the key that goes to this. Look, when somebody else is holding the checkbook and you want to get paid, don't make it hard for them to write a check. Make it easy. Tell the story. Make sure you document it and clearly articulate it in English or Portuguese or Spanish or whatever your mother tongue is in whatever country you're in, that you speak the language of that person that probably has no more than an 8th grade reading level that is writing the checks. Tell the story. Don't use travel cards. As far as I understand, once they came out with ICD-10 codes, which has been over a decade now, we were no longer supposed to use paper records at all. We were supposed to have a digital record system, an EHR record system. And we're supposed to take notes in real time, immediately that day. We're not supposed to alter them later. This is another ethical thing, but going back to the ethical one we talked about. If you're using chicken scratch notes and then you're trying to make up a report at the end, going back, well, what did I do with Sally that day? Well, it says on my chicken scratch I did this and this, but was she a 0 or a 5 or a 10? I don't know, I'll just guess. We just start making stuff up. The ethics of that, of forging records, is just so unbelievable. And I know doctors do it. I'm not saying anybody in this room is doing it, but I know that doctors out there in the world are doing it. And I'm asking you, please don't do that. Have a good EHR system. If you want a good one, I recommend Platinum Systems. It's amazing. Or we could talk about some other ones after the seminar. Have a good EHR system. Use good templates. Don't expect your EHR system to do all the heavy lifting and just cookie cutter your reports for you. None of them do a good job on that. And any insurance adjuster or Colossus software can see right through that stuff. So you want to make sure that you're doing your reports yourself and you have an EHR system that makes everything else in your office flow smoothly and your soap notes are smooth and easy. Powerful, powerful stuff. Wow. I'm just sad I even have to make a slide about this, but there are some practices out there that actually upcode or use the wrong codes for things, which is unethical billing or fraudulent billing, just to try to make more money. Look, one of the biggest mantras we have in the Whiplash group is income is a byproduct of service. So serve outstandingly. Just do a great job serving and doing the things that we teach you to and the other coaches that we cross-network you to. Do those things and you can sleep at night and you can make good money ethically, legally, comfortably, and everybody wins. But we don't want to be fudging the numbers of saying, oh, well, I saw it for 4 minutes, but we're supposed to charge. We only charge after 8 minutes, but we're going to go ahead and charge for this therapy. It's just not worth going into the gray. Just keep it clean. And there are great billing codes. And look, if you have a relative value scale for your state or your country, I guarantee you it's going to be higher than you think you would get paid for doing this. Some people are charging $500, $600 a visit, $400 a visit, and I'm recording this in 2025. $400 a visit is still, I think, over the top for a chiropractor or PT to charge per visit. In most states, $350 is the top, where you don't want to charge the highest. Can you? Yes. Can you charge higher and still get paid? Some docs do. Are we pushing into the gray? Absolutely. Are we making it uncomfortable for the attorneys? Absolutely. The insurance companies would rather see you charge more and serve less and cut them loose. But ethically and following the research guidelines for the best outcome for the patients, it's just better to charge a little less, but serve them more. Follow the Croft guidelines, treat to fruition, co-care with other doctors to make sure that we're doing the right things at the right time to maximize tissue recovery, minimize long-term chronic arthritic change or scar tissue formation in those soft tissues that were injured. Remember, in a car accident, we'll hear it all the time from the ER, oh, it's just a soft tissue injury, or it's just a whiplash. There's no such thing as just a soft tissue injury. Every tissue in our body is soft tissue, except for bone. Our blood vessels, our brain, our ligaments, which of course don't heal very good. They don't have a good blood supply. They don't recover very well, which is why we need to do what we're doing. These are important things to understand in personal injury. It's not just a soft tissue injury. it's a big deal when it's a soft tissue injury. Your brain, your organs, all that stuff is soft tissue. Yikes. So don't upcode and don't build the wrong codes. Make sure you're very careful and you have trained billing specialist that watches what you do, watches your SOAP notes, watches what's being billed out, make sure they line up, and they should be able to cancel, like, hey doc, we should be able to do this on this patient and bill for that. Or, hey, we can't bill for this doc because you did this. Don't push back, docs. I mean, empower your staff. When you have a good billing person or a good CFO, you need to empower and trust them because they're watching your back to keep you out of trouble. So, good news, good advice there. This one's gonna burn some bridges, and I don't mean to cause any stress, or I don't mean to offend, but look, we talked about earlier the brain surgeon versus a certified brain surgeon. In personal injury, in most states, the attorneys can't say they're certified in personal injury. They can get certified. They can sit next to you in class and train and do the same certification things and take the same tests as you do, so you as the physicians know, like, and trust them better because you're speaking the same language. And that is powerful for these attorneys. But they can't advertise that they're certified in personal injury. But they can sure as heck say they're a personal injury attorney or they treat personal injury. Well, so can Uncle Fred, who's a divorce attorney, take a personal injury case. Just what we talked about earlier, we're all licensed to treat personal injury after we graduate medical school or chiropractic school or PT. Same with the passing the bar, you're licensed to practice whatever kind of law you want, but that doesn't mean you're good at it. And personal injury is complex. And attorneys that think they can dabble in personal injury while they're doing estate planning and divorce, they're going to screw up the case, guaranteed. Just like us doctors screwed up if we don't know. So that's why we want to have like-minded doctors and attorneys training together and working together. And I'm guaranteeing you guys and gals, you will have better outcomes for your patients or clients, better outcomes for your reimbursement for yourselves, better outcomes for reimbursement for the patients for their loss. Everybody wins. So working with attorneys that dabble in personal injury, it's a huge mistake. Oh, it's my brother, it's my uncle, it's somebody in my local church. Look, if they're not willing to get trained and sharpen their skills in this field, it's not worth referring to them. They refer to you, their personal injury case is great. Have a sit down at lunch and talk about how you can both get better at what you do and get trained and certified in personal injury. And for your career, it's a game changer. Again, the ROI is huge when we just invest in ourselves to learn these things a little bit better. This is about the most important single paper in a care or case file, the lien. Docs, if you're willing to work with attorneys that aren't willing to sign liens, I don't know why. I don't know why you'd ever even think about doing that. When the lien or the promissory note to pay shows the integrity of the attorney that values what you do. They're not going to try to just go, oh, we didn't need a lien, we're good. Just trust me, I'm going to take good care of you. And at the end, they come up with some weird way to hack your fees and you have no leverage. Now, ultimately, it's the patient who's responsible for the bill. And you can go after the patient. But it's a lot harder to get paid from the patient when the basket full of money is just sitting right there. The attorneys are just hoarding it because they're not willing to sign liens. Sorry, attorneys, I'm going to throw you under the bus. But either the good attorneys are willing to sign a lien with you and go to bat for that patient with the insurance, knowing they're skilled enough to get this settlement done. Because most of these personal injury attorneys advertise no payment if we don't win. And it's complete BS because if they don't win, they just try to get you to pay it by reducing your fees. Some of them, the really good ones, which we've worked with so many good ones in the course of our career where they wouldn't hack our fees, they valued what we do, but every once in a while we still had to all lower our fees together as a team. The case just went sideways. The patient wasn't a good witness for themselves. Or maybe they weren't as honest about what happened as they thought. Or maybe they had a concussion so bad they weren't honest and didn't know it and messed up the case. So now the attorney is trying to patch it up and just get it settled rather than really fighting hard. And so they're like, look, we'll take a hit. We're going to take 20% off, doc. We're asking you to take 20% off. We're asking all the providers to take 20% off. It was a team effort to lower the fees. Let's all do that. That's ethical. That's teamwork. So it doesn't happen very often, but when it does happen, that's the way to do it. Now, what usually happens is an attorney just asks all the doctors to cut their fees because they're just bloated overcharging people and it's my poor client. The doctors didn't cause the accident. Why are they responsible not to get fair exchange for the services that they rendered after the years of sacrifice to their family and their finances to go get student loans and go get an education to be able to help these people in the first place? So there's got to be fair exchange. There has to be communication, and that's where teamwork is such a big part of what we do in the Whiplash group. Number 10, failure to nurture that personal and professional relationship with other doctors and with attorneys, or attorneys with the doctors that treat your clients. Some of our great attorneys in our state, they put together, they organize seminars for continuing education training for our doctors to come to nurture those relationships and give to get. It's the old BNI, or Business Network International quote of givers gain. You have to give to receive. So they're giving education, they're giving an opportunity to network together and rub elbows and show, hey, look, I care about you guys enough to give something to your profession. Hopefully you guys will reciprocate and refer to our office because we actually value what you do. Attorneys, I think that's your number one, whatever state or country you're in, that's your number one tool for planting seeds of referral from the doctors that you want to work with. Doctors, it's nice when we can show the respect and actually go to their events, network, and work with them. It's great. Now, I don't know if all attorneys that do that are that ethical. You got to use your own little ethical barometer on that, but it's a great tool. But the easiest one, the most cost-effective one, is to just go to lunch once in a while with the people that you like to work with, the other attorneys and doctors, or the other doctors and PTs and stuff. But nurture those relationships. And of course, the other one is sitting next to each other in seminars and chit-chatting during the breaks, showing that you're willing to learn things together. What a powerful, powerful tool to help nurture those relationships to work together in personal injury. Just a couple of great tips on common mistakes that we chiropractors, and a few of those were on the attorney ones, that we make in personal injury. Now this is another one. The final bonus one here is the failure to charge interest. So many doctors don't charge interest because attorneys peer pressure them not to. Nobody in the profession, nobody in personal injury charges interest. What business would you go to? I don't care if you went to Lowe's. If you walked out with something without paying for it, that's theft. Okay? And if you go to the bank and get a loan for your car, or you go get dentist work done on credit and you don't make your, they're charging interest after 30 days. Every business that provides a service or a goods and isn't paid in full is charging interest after 30 days. If we're charging interest, doctors, we're showing that we value the services that we render, and we're lighting a fire, attorneys, for you to get your guys' work done quicker rather than just putting it back on the back burner and waiting till everybody's sick of the case and you try to settle it, which honestly was the business model of one of the large TVPI firms in my area, where they just let things simmer for 4 years until the patient and the doctors were all just sick of it, and then everybody would just take a cut so they could just settle it really easy because they didn't want to do any work. What a horrible business model. Well, attorneys, you should be working hard, and I'm going to say this is, and we're on the chiropractic mistakes here, but attorneys should be communicating with doctors and getting their records right up front. Getting the emergency records right up front, because they're not going back to the emergency room, so why wait till the end of the case to get those records that then take 30 days to 6 months to get? Just get them early. Have your finger on the pulse, attorneys, of the case early on. Follow up in the middle, and then on the final, start gathering up stuff again, and there's a lot less to gather, but at least you were able to communicate through the course of it and guide the case, communicate with the doctors. Hey doc, I noticed here they've been telling us, because sometimes they'll tell you guys, or docs, they'll tell your front staff stuff that they don't tell you, the patient. They've been saying they're having trouble with shoulder. You didn't document that, but maybe we should get an MRI of the shoulder. The attorney should be able to say something like that to you doctors and you not be offended. Now, if the attorney is referring out for the MRI, they're practicing medicine without a license, and that's not good. But the attorneys that are asking you to take a double look at the case and the case and the patient, and maybe pivot some or order something, that's perfectly fine. We should totally be good with that and help out with that. So we should be charging interest. Now, here's another reason. If a patient fires their attorney and now they're playing attorney and they have no skills at being an attorney, how good does that feel to you? But now you've got that interest to charge more. So when you take them to small claims or whatever, the judge is going to look at that and be perfectly fine with adding at least a year's worth of interest. Because they're screwing up and not getting you paid for the work you did. Now they're trying to play attorney without a license. That's not your fault. Or an attorney that you don't know, like, and trust is dragging their feet. Why shouldn't you get some interest for waiting? Maybe you cut half the interest. They're happy, the patient's happy, and you still got something. But if it's a patient and if it's an attorney that you know, like, and trust, don't charge any of the interest at all. We don't charge interest if the patient is paying some small payment per month until it settles. Watch this. It keeps the patient engaged. They're seeing their fee every month. They're seeing that it's dropping when they pay. Now, someone might be like, why am I paying anything? I didn't cause this. I know. But if you pay, you're not getting any interest, which is saving you a lot of money, which is more money in your pocket when the attorney actually settles the case. And it's lowering your actual outstanding. So it's like a savings account that when the attorney settles your case, you'll get that money back. But now everybody's staying in the game and communicating till the end. The patient isn't just going, if my insurance doesn't cover it, I'm not going to pay it. Or if my attorney doesn't pay it, I'm not going to pay it. Baloney, it's your bill, patient. So let's all stay in this together. We didn't cause the accident. We don't deserve to have a theft of our services. Just show respect towards paying our bill. Attorneys, see the form that the patient, we have forms on the website for the Whiplash group that patients sign. It's very non-confrontational. It's just like, hey, look, every business charges interest. We charge interest, but we don't charge any if you just pay $5 or $20 a month or something till your case settles. But that's them now. Gosh, I keep paying each month for the doc. How's our case coming, attorney? Lighting a fire under the attorney's butt to get this thing settled up quicker. Great way to do it. So attorneys also like this. The good ones really like interest because it's now inflated your case to make a stronger case for more payment from the insurance. And then if you guys write off the insurance later as your choice, that's great. That's more money in the attorney and the patient's pocket. But you help leverage that case. So when the attorneys are barking at you about interest, because they don't understand how to leverage this thing properly, how you're helping keep your patient actively engaged in their care. It's a very, very good tool. So I hope you guys utilize it. That's all I've got for you today. I'm going to ask that you scan this little Scantron on Untold Truths About Chiropractic. It interviews myself and 3 other chiropractors, one that specializes in pediatric chiropractic. They've done a 3-year diplomate in that. Another one's done functional medicine. That's additional training. Another one's a sports chiropractor. That's additional diplomate training. And they've got their own cool technique. They used to be the professional chiropractor for the Jazz. Chiropractic has 43 to 46 different diplomate programs postgraduate. Personal injury is becoming one of those. It's an area of specialty with additional training and testing. I encourage us to up our game. If we're going to be working in personal injury, work with other docs that are certified or get certified yourself. And let's just really help save lives in our community together by just being the best docs and attorneys. Thank you.